not just my mother and my mother-in-law, happy Mother's Day in advance going into this weekend, but yours as well. It's been a very different year, obviously, for many of us, so I'll also be spending some time this weekend thinking about all the mothers that we've lost and all the families that are enduring this time. With that, we've got a very two reports, substantive reports, so we're going to get right at it, and we'll move from Dr. Box's updates and reports to our budget director, Chris Johnston's report on where we are financially speaking, right into the Q&A, Rachel, so we can maximize our time. Dr. Box?
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 675 additional cases of COVID-19 in Indiana, which brings to the total 23,146 Hoosiers known to have COVID. That gives us a positivity rate of about 18% amongst the 130,128 Hoosiers that have been tested to date. Unfortunately, we also saw 33 additional confirmed deaths. To date, 1,328 Hoosiers have died of COVID-19, and another 119 are believed to have died from this disease based on their clinical diagnosis. As you can also see, our ICU bed capacity and our ventilator availability is holding steady. We have new hospitalization data to share with you today and some enhancements to our dashboard that will make this information more accessible to you, our viewers. Our partners at Regenstrief, IHI, FSSA have all looked at 22,633 cases of individuals who have tested positive for COVID-19 since March the 1st. These results are from both private and public laboratories and represent patients who are linked to hospital data. Of those individuals, 6,136 went to the emergency room for a rate of about 27% of them showing up to the ER. That's down from 33% who sought emergency room care 2 weeks ago. We also have seen our hospitalization rate drop, which is encouraging, from 19% of COVID-positive patients who needed to be hospitalized, down from 27% 2 weeks ago. And of those who were hospitalized, 23% were admitted at some time during their stay to the intensive care unit, which is also slightly down. To date, 70% of COVID patients who are hospitalized have been discharged. That's down from the 80% 2 weeks ago. Approximately 16% of COVID patients are known to have died while hospitalized. The remainder are still believed to be in the hospital. You can see those trends in the next slide. We were also able to break down those hospital trends by region. You can access all of this data by clicking on the Additional Resources button at the top of the dashboard that's updated daily. I can't thank Regenstrief, IHI, and FSSA enough for all of their help with this data. I also want to provide an update on the research study being led by the IU Fairbanks School of Public Health and other testing efforts underway across the state. I'm pleased to report that the first phase of the Fairbanks testing has been completed. There was a lot of interest in this effort, as you can see from the pictures. A total of 4,611 Hoosiers participated. The Indiana State Department of Health and our partners managed 70 total testing sites across the state. The turnaround time for viral testing was 1 to 2 days and was 2 to 4 days for antibody testing. The data is being analyzed and preliminary findings are expected early next week. I want to thank Fairbanks for this study, and I look forward to their insights. I also want to put in another plug for the testing sites that are currently operating around the state. We have 20 sites through our large-scale testing program and are operating drive-through clinics in East Chicago, Lafayette, Newcastle, Plymouth, and Seymour through tomorrow, with more to come next week. I encourage anyone with symptoms, anyone who lives with someone who has symptoms, people who have been exposed and need a test to go back to work, and those individuals who are high risk, such as individuals who are over 65, people with conditions like diabetes, obesity, high blood pressure, and those members of our minority populations who are at greater risk to come and get tested. If you're at high risk, please get tested, even if you don't have symptoms. These tests are free. You just need to provide proof of residency, whether that's a state-issued ID, a work ID, or even a utility bill with your name and address on it. We want to remove any barrier that you may have to testing. All of these sites are listed on a testing map at www.coronavirus.in.gov. You can search by county and find the locations nearest you. You also can find out information on how to register for testing at one of those large-scale sites here. It has also been reported that Indiana has received an initial shipment of remdesivir, and we are working with local officials to determine the appropriate patients to treat with this medication. The federal government initially shipped this to a major hotspot here in Indiana. Remdesivir is an antiviral medication that has received an emergency use authorization from the FDA so that it can be administered to COVID patients with severe illness. This medicine has been used to treat illnesses like MERS and SARS, and studies show that it can help shorten the illness or the length of severe cases for COVID-19. Thank you very much.
Thank you. And just to follow up on 2 points, just so I'm clear and everyone that's watching. One, you'll be able to share more information on that Fairbanks study, the 4,600 tested, next week.
Early next week.
Early next week. Okay, got it.
Putting them on notice.
Yes, and then the testing that's occurred in these 70 sites, we'll get up to 50 sites, 20, and then plus the 30. Now, if you're high risk, it's not just you're symptomatic, it's not that you've been around someone who was positive or that you're a front line. Now, if it's if you're high risk category,
You can be asymptomatic, but if you're in the high-risk category, please come and get tested.
perfect. Chris, you want to give us an update on our financial situation?
Absolutely. Good afternoon. Earlier today, the State Budget Agency posted to its website the monthly report for April tax revenues. I'd like to share some observations of what is in that report, but I also encourage you to go out to the State Budget Agency website for additional details. First, I'd like to revisit where we ended the month of March and started the month of April. On the chart that's provided, again, you can see that there are individual bars for each month of the fiscal year. The bar on the left represents the estimate from the December 2019 revenue forecast for that particular month. The bar on the right represents actual collections in that month. The line chart shows the difference between that estimate and the actual collections. We reported in March that revenues missed their target by $70 million, or 6%. The March shortfall essentially offset the accumulated positive outcomes over the prior 8 months and brought year-to-date revenues, while still slightly above forecast, essentially level with that December 19 forecast through that point in time. Revenues missed their estimate across all major categories, including the initial impact from the closure of casinos for part of their reporting period. We also pointed out that the final quarter of the fiscal year has been and was expected to be the highest revenue producing quarter, with April the highest month. However, that target was no longer realistic with the deferral of Indiana's tax date to July 15th for filing returns, along with those final payments, and coupled with estimated tax payments for corporations and individuals. Also anticipated were the initial economic ramifications of fighting COVID-19. April collections were estimated to be just under $2.2 billion. Actual collections were a little over $1.2 billion, a shortfall of almost $1 billion, $964 million to be exact. Where the state was essentially even for the year compared to the forecast going into April, it is now almost 7% below because of the single month drop of 43%. As a point of reference, the revenue miss in 2009, the last recessionary period, was 7.9%. So how much of April is due to the timing difference, and how much is due to the difference or driven by developing economic conditions? The next slide compares fiscal year 2020 with the last 2 fiscal years for both individual and corporate income tax returns that had accompanying payments made in April. As you can see, there was a 2/3 drop or a decline in those filings. The impact of those payments relate to those filings are captured in the next graphic. Here, the $964 million is broken down between these tax administration matters and the other economic impacts. Almost $800 million of the $964 million, or 80%, is due to the tax deadline moving. While we hope that $800 million is mostly just a timing difference, we cannot avoid recognizing the risk of the inability to pay the full amount come this July. The remaining 20% from other sources, such as sales tax, withholding tax, gaming taxes, provide more of a perspective on the impact from the economy. You will see in the detailed report that sales tax collections were off by $100 million, or 15% from its target. The gaming tax is the entire estimated amount for the month, as casinos were closed during that industry's entire reporting period. The next slide shows the contribution of each revenue type for the final 2 months of this fiscal year, May and June. May estimate is $1.2 billion, and the June estimate is $2 billion. Sales and income taxes are the major contributors. And as a reminder, sales tax is remitted to the state in the month following the transaction. So the April sales tax shortfall of $100 million was probably reflective of only a partial month of the stay-at-home policy and business closures which went into effect in the second half of March. It is difficult to estimate how much more of that impact there will be in May collections, but it will be more reflective of an entire month's effect of our stay-at-home policy and the business closures. A mitigating factor is that the state has implemented effective online sales tax collection protocols. There will also most likely be an impact on income taxes due to the economy, but also due to staying in sync with federal tax dates. Again, gaming taxes will not be collected in May as the casinos remain closed. Needless to say, the remainder of the fiscal year will be challenging. But we also need to look beyond the next 2 months. In my previous remarks, I have mentioned that revenue estimates were short by over $3 billion in a 2-year period in the last recession. It took several years to return to pre-recession revenue levels. Moody's Investors Service, a respected credit rating service, issued a report recently that forecasted that state government revenues in general would not return to 2019 levels by 2024. So what are we doing now that we're facing this economic climate? In April, we issued a financial management circular to all state agencies outlining a variety of cost-saving measures that should be pursued. Soon, there will be a memorandum setting significant spending reduction targets for agency programs. We plan to work with the Budget Committee, most likely the timing is this summer, to update the official revenue forecast. In using this information for 2020, we will use this information for the 2021 budget session and beyond, which will also include efforts to restore the reserve levels, which will be significantly reduced. Some called the fiscal environment after the last recession the Great Reset. Programs and institutions we had become comfortable with had to be rethought and adjusted. Similar steps will be required, and probably quicker action will be required, all in the world of social distancing and remote work environments. But it can be done. This final chart shows the historical year-end reserves. Reserves have been used to manage through recessions, and the same will be needed in conjunction with spending reforms that will be pursued. Fiscal year 20 reserves will not resemble the recent trends on that chart. The 2009 recession took reserves down to 6 to 7% of state revenues, but were judiciously built back up to help address fiscal issues just like we face now, however unimaginable they were just a short time ago.
Thank you, Chris. Actually, Rachel, I'm going to call an audible. Commissioner Fred Payne, can you just step up very quickly and share with me about the PUA disbursement process that you have underway as of today, and the numbers of, you were at 57,000 this morning.
Okay. As I announced on yesterday, we were getting ready to implement the payment disbursement portion of our PUA, our Pandemic Unemployment Assistance Program, for our independent contractors and self-employed. Today we released payments to 57,000 of those claimants, totaling approximately $119 million. So that takes our state's total, inclusive of federal payments, to over $1 billion in unemployment insurance payments throughout the state.
Thank you, Fred. Rachel?
Nikki Kelly, Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Governor, I was wondering if Chris Johnston could tell us where the state surplus is right now, what we've been spending out of it so far?
I'm sorry, spending out of
The
what?
state
Oh, the federal assistance program, Nikki?
No, the state surplus?
Oh, well, we've been spending out of our the existing appropriations this year, and then we will be starting to draw down the reserves.
Nikki, do you have a follow-up?
No, I'm good.
Okay.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. I got a question for Dr. Box and a question for Chris. Dr. Box, you told us in your report, so far we've seen more than 1,300 Hoosier deaths, but the Institute for Health Metrics is predicting possibly more than 6,000 deaths by August 4th. What are Hoosiers to think, to believe when they see all these numbers in front of us, particularly as we start to get more engaged with each other? What do they believe? What's a good guiding star for them? And for you, Chris, has there been any federal help or federal assistance to help us plug up these billion-dollar shortfalls that we're seeing right now in our state budget?
Go ahead.
I'll take the second question from Abdul. We have received the Coronavirus Relief Fund, which is a significant contribution to all states. The directives from the federal government is that it has to be used specifically on direct expenses for fighting the disease. So it's prohibited from being used as revenue replacement. My understanding is that there is discussion out in Washington about a potential fourth package that may consider direct assistance to state and local governments. But right now, the federal assistance is being used directly to fight COVID-19.
And Abdul, I think you're referring to the Washington model that now is predicting by August about a little over 6,000 deaths in the state of Indiana, which is certainly up. Their prior prediction was up until June 1st, so I would expect those numbers to go up. When you look at that model, however, it, like all models, has significant issues, and a part of that model's problems is that it has, as baseline numbers, ventilators and numbers of ICU beds that are quite a bit different than what the state of Indiana actually has, which is going to overestimate the number of people who could potentially die because they wouldn't be able to have the care that they need. Again, we're focusing more on those real-time numbers that are out there that we're looking at on a daily basis and weekly basis very, very carefully. And I think the other thing it doesn't take into account is that we really are not opening things up for our highest risk populations. We're continuing, even as people return to work, to ask that our individuals over 65, those with chronic medical conditions, those who are immunocompromised, those individuals who may be at highest risk, to continue to kind of hunker down at home so that we can continue to protect them.
Yeah, and I would just say, Abdul, to answer your question very directly, what should Hoosiers think? They should think and know that we'll continue to look at all the models that are out there that are able to be publicly consumed and by our state government. We're looking at them all, and most of them change, and some of them are wildly off mark in the past. But we look at all data comes into us, we pour through it all, and then we look at what's happening on the ground in the state of Indiana, and that's what we react to.
Sheila, WLKI.
Good afternoon, Sheila.
Good afternoon, Governor. How are you?
Very good. And yourself?
I'm good. My question today is about education. As you know, under the leadership of Governor Mike DeWine in Ohio schools are considering a mix of 2-day weeks and continued remote learning for 2020-21, the new academic year next fall. Is that something Indiana's looking at, or can you maybe speak about the things that you and your Indiana team members are looking at for Indiana schools? And potentially, will Indiana teachers need to be equipped with things like masks when conducting education business with students and families?
Yeah, we're working with, and I'll have Katie if you speak to this, but Sheila, we're obviously working with all the stakeholders. I actually talked to Governor DeWine this morning. I talked to Governor Beshear this morning. This was one of the many items that we discussed, was the different timelines, all the different stakeholders, the teachers, the difference of, schools are somewhat unique in the sense that we have to be concerned about the transportation, we have to be concerned about the meal distribution, we have to be concerned about the density of students all being together, the students, the teachers, the different age groups, all those things factor in, and then the timeline and how we will do things differently. That's something that we're working with the Department of Education with right now and other stakeholder groups. We want to make sure that we are prepared for July, the important dates that will start to come at us, and we'll have that updated yet this month. But Katie, you're in these discussions on a hourly basis every single day.
Yes.
You want to give us completely up to speed?
Absolutely. I'm Katie Jetter, Governor Holcomb Senior Education Advisor. And Sheila, great question. As an educator and having spoken with many educator friends throughout the state, we are absolutely eager to have our students back. And then also as a parent of 2 elementary students, I am personally eager for the day they can run into their school building, as I know many parents are. However, all that being said, and Governor Holcomb covered this, we want to make sure it's safe. That is the most important. Safe for our students, safe for our educators. And as Governor Holcomb mentioned, we are working closely with the Indiana Department of Education, our State Board of Education, the Commission for Higher Education, and many educational leaders who have shared their thoughts forward with our team here to think about how this might look in the fall. And in the coming weeks, as we review data and determine the best options for our schools, we will certainly be eager to share that forward. And again, thank you for the question.
Thanks, Katie.
Adam Wren, Indianapolis Monthly.
Good afternoon. How are you?
Good afternoon. How are you? Thank you
Great.
for taking the question.
Sure.
As you consider different types of models in this reopening plan, did you look at models that suggested that more Hoosiers would get infected with the coronavirus and possibly die as a result of the reopening? And Dr. Box, just a quick question for you. Does it give you any heartburn to know that Hoosiers in just a matter of days here will be, venturing out to the ballot box to vote, even with the number of historic changes that have been made to voting procedures as a result of the coronavirus?
So,
You want to talk about all the different studies that we looked at?
So we have looked at many different models, and all models say that as you open things back up, no matter how careful you are, you will have more cases. The point of opening up gradually is to make sure that we had everything in place, tracing, contact tracing, that we had the testing that we needed across the state, that our hospital systems were where they needed to be from a staffing and a PPE standpoint, that we knew that we were capable and ready and able to respond immediately. Also, to have all the data systems in place so that we knew we could get real-time data, like our EMS data and like our data for emergency room visits and our hospital admission data. But I think that as we look at this, the other very critical thing was, until we get a vaccine, until we get medication that we know can treat and really knock this out for people, we still have to be very careful of our vulnerable populations that we know are the populations that are most likely to die from this disease. And that is why we've been so careful with that. And honestly, that we don't have any concept or idea when that's going to come about, to be very honest about that. So we're working very hard with all of these numbers and looked at all of these models, and we're going into this with eyes wide open. But we have every intent of making sure that as we look at this county by county, region by region, hospital system by hospital system, to address the plan and change it if need be going forward.
Yeah, that's the bottom line, is our roadmap can change along the way. Just to answer you directly, Adam, we're concerned about a lot of things. And Dr. Box is spot on in the sense that we want to make sure that folks have the right information that they can take into account as they conduct their affairs. And that's why we're here every day, and that's why we're making updates every day. But that roadmap can change according to the facts on the ground. This is as you remind me every day, this is a novel virus, and we don't have, as much as we want to have all the answers about how it will be tomorrow or the next day or the next month. And so just by the very definition of what this virus is, we're going to have to be nimble. We're going to have to be agile. We're going to have to be willing to change course if need be. I also wanted, Rachel, before we move forward, I'm going to call another audible, and I'm going to call up Brigadier General Dale Lyles. Brigadier General, would you just give us a brief update, because Adam also asked about June 2nd and voting. And I probably ought to ask Secretary of State Connie Lawson maybe to join us on a day next week, because June 2nd is right around the corner. But she has made sure, and now supported by you all, the women and men in uniform, to make sure that we have safe and secure elections come June 2nd. You want to just give folks an update on that front?
Yes, sir. Brigadier General Dale Lyles, the Adjutant General for the Indiana National Guard. In partnership with Secretary of State and her office, and both from the Democratic side and the Republican side, we have partnered with them in order to determine how much protective equipment needs to be distributed to our polling sites so that we can protect all of the workers at the polling sites. And over the course of the next 5 to 10 days, we will be delivering enough PPE for all of the workers at those sites to be protected as they work through the voting process. Additionally, she has a very robust plan to ensure that the voters maintain the right physical distances and that things will happen very smoothly and very transparently.
Yeah, thank you, Brigadier General. I think, Adam, by pushing it back a month, we made the right decision.
Meredith WLFI.
Good afternoon, Meredith.
Good afternoon. How are you doing?
Doing well, thank you. Yourself?
Not too bad. It's Friday. How can you be bad on a Friday? So my question has to do with larger companies. Obviously here in the greater Lafayette area, we have a ton of large companies. SIA, we have Wabash National, Caterpillar, just to name a few. So how many cases of the virus do these large companies and industries have to have before they're required to shut down and do a deep clean? And if there isn't like a hard and fast number, why not? And why is this kind of being left up to those companies? How do we make sure that these don't turn into hotspots and breeding grounds for the virus?
It's an excellent question. As we go forward, a big part of what we're hoping to do by taking some of the burden of the long phone calls to do the initial history for contact tracing and then contact tracing all those individuals, we're hoping that our local health departments will be able to engage even more so with boots on the ground. And as we identify a cluster of cases in a particular business, we can be engaged with them, and that will be in their best interest, right? And we have had plants that we were not brought in on the ground floor, or things were kind of out of control before people realized how many individuals were sick, and ended up with 53% of a particular plant that was infected. So we really want to be there in partnership from a public health standpoint early on, so that we can go in, instruct where needs to be cleaned, who else needs to be tested, what parts might need to be shut down, whether that is a second shift or third shift, or hopefully just test additional individuals individuals and make sure that they're cohorted out and spend their 10 days if they're positive at home until they're better, or 14 days if they need to be quarantined. So it's a very good question, and I think it's important. And we have worked really hard with companies already and have developed, I think, that rapport and relationship that we are there to help them, not to close them down.
Kara Kinney, RTV6.
Good afternoon, Kara.
Good afternoon, Governor and Dr. Box. Thanks for taking my question. We continue to hear from families who say the nursing home numbers that they're getting from facilities via email are just not matching up with what the staff is telling them. And some are pushing for the state to post those breakdowns by facility on the state's dashboard. And meanwhile, more and more county health departments like Boone, Johnson, and even Hendricks County today are releasing this information. What's your response to those families and now counties who say the public should see this information?
I think that the local public health officers and public health departments have the right to release that information if that's something that they're comfortable with and they've worked with those institutions and feel that's important for their community. I continue to support releasing aggregate data, and I continue to say that we have posted on our website the availability for anyone who is having issues as a family member or a resident with getting this information to reach out to us, and we will investigate that for them.
Kathy
Thank
Tretter.
you.
Thank you.
Thank you.
Kathy Tretter, Ferdinand News.
Afternoon, Kathy.
Good afternoon. Dr. Box, I'm having a hard time understanding when you say anyone in that range of people over 65, health issues, et cetera, should be tested. I don't understand why, even if they're asymptomatic, because as I understand it, I could go to the post office today, somebody could infect me, it may not happen for a few days, and then I would indeed have to go back. So I've been trying to understand the rationale and how that works.
So it's a very good question, and it's something that, as you know, we have gradually worked up to this. But the opportunity to test our higher risk individuals, number one, means that they may very well be living with someone else at home or living in a situation with other individuals that are also very at high risk. They may be individuals that are immune suppressed, so they're attending maybe a cancer clinic for treatment. They may be individuals that go regularly with their buddies and spend time in a card club or something, which again, we would not be recommending, but it's important if we know that these individuals have this, that we can make sure that we are looking at all of their contacts and addressing those contacts. I think it's also important that individuals that are at higher risk, that they would want to contact their healthcare provider so that they could be supported by their healthcare provider, so that we could do everything in our power to make sure that they receive the medical care and the support that they need as soon as they need that.
Sherry, the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon, Governor. Good afternoon, Dr. Box. I have two questions for Dr. Box. One is, as antibody serology tests are becoming available, and some places are even offering them for free, do you have any advice to Indiana residents? Should people be going to get these tests? And is there a group of people who should be getting these tests? And my second question is, you mentioned the positivity rate, and I know that sort of shifted over time. I wonder if you thought from the state health department, since you've also said that's going to be a measure that you're going to look at, whether there's any way to display on those graphics how the positivity rate for the state is changing as more tests are being done. Because the positivity rate is a cumulative rate, as I understand it, from what we currently see.
Correct, correct. So the more tests that we do, specifically the more people that we test that may be asymptomatic, or the more individuals that we test that may be mildly ill, that positivity rate will, I expect, go down. And under those circumstances, that's another sign that we are testing more individuals, and it may be over time when we get to the point where that positivity rate is very stable. If that continues to drop, we're going to know, well, that's probably because there is less community actual infection out there. So right now, it doesn't mean a lot other than it does mean we're enhancing our testing at this point in time. The antibody tests, I don't know if you saw, but the FDA actually pulled back a lot of the antibody tests. Originally, they kind of made it a free-for-all, and a lot of companies out there were testing, and they were not really very good tests that were out there. So I would be cautious about tests that were done. Even with our current study, we used what we felt like in research was the best antibody test out there, but we did save some of the serum back in case that test over the long haul proves not to be the best test that's out there. Then we will be able to test with another test. So I'm just very cautious about that. I'm also cautious about the results that you get back from that, because if that says that you're positive, again, we don't know what that really translates to mean. Does that mean that individual cannot ever again get infected with the SARS-CoV-2 virus or not get COVID-19 again? Or does that mean that immunity lasts for 6 weeks, 8 weeks, 12 weeks? So I think it's really important right now I think it's academically very interesting. I think in the very near future, it is going to be a very important test for us as we're helping people to get back to work. And we know that individuals that work in long-term care facilities, for instance, are positive, and we know what that immunity actually means that you're positive. That will be helpful for us. Right now, it's not the best test there.
Sara Clifford, the Brown County Democrat.
Hello, Sarah. Good afternoon.
Hello, everyone. I have a question from a reader, and it's about unemployment. She is self-employed and has been unable to work since March 25th. She's been approved for PUA benefits for April 19th on, but she can't figure out how to make a request for any date before April 19th. She says the program isn't allowing it, and she wants to know where to find that guidance.
All right, that sounds like a question that we may need to update our frequently asked questions about. If it's a frequently asked question, then that means that it's a common error that we're seeing. So if she could follow up with us and send a message about that specifically, we'll have someone to follow up with her.
Victoria Ratliff, the State House File.
Good afternoon, Victoria.
Good afternoon, Governor. According to research by Harvard's Global Health Institute, Indiana should be conducting about 428 COVID tests per 100,000 people, which is nearly 29,000 people per day by May 15th, to help protect against a surge in the number of cases. Right now, our numbers are about 61 per 100,000. My questions are, when, if ever, do you expect us to reach the level of testing recommended by Harvard? And are we in any way gambling with the health of Hoosiers by, beginning to go back to business?
So those are excellent questions. I would say to you that assuming if that's almost 30,000 tests a day, that's basically looking at every individual that's employed in the state and testing them on a certain, with regards to a certain frequency, whether they are symptomatic or asymptomatic. We are certainly not at that level right now. I do foresee in the near future that we will be able to test that many if that's the way CDC and businesses and other individuals want to go with this. It won't be by May 15th, certainly. The Optum test sites will be allowing us to test well over 100,000 people a month, plus the additional over 100 sites that we have now. And as we are able to potentially help our labs to have more access to what they need to run more tests, then we can even increase the baseline number that they're running now.
Yeah, and I would just add on to that, the answer is no. We are not gambling with people's lives. We are making decisions. This is not an exercise of paralysis by analysis. We ultimately are here to make decisions and to act. Others are having to do the same thing in their daily lives. We are looking at this on 3 different fronts, and it's a mission on each of them. One is obviously, first and foremost, is health and managing this health crisis that's washed upon our shore here in the state of Indiana. It's got to do with lives and livelihoods. So we're dealing with a jobs roadmap as well, trying to get people back to work safely. I don't want anyone to gamble with their life. That's why we're putting the information out on a daily basis so that they can make smart decisions. And if they have underlying health conditions, don't re-engage in a public fashion, or if they're above a certain age, et cetera. When you start to see the percentages increase and how it may adversely affect your life. And then you heard from Chris Johnston here today. We're also we have a mission to manage our way effectively, which we're known to do here in the state of Indiana on the budget front. And so the health front, these are all three separate journeys that are all related to one another. The health front, the jobs front, and the budget front. And fortunately, we've got a roadmap for each. And it is not a, what are the odds are that I'll experience a fatality if I re-enter. This is putting out information. I don't know if you want to add to that, but this is not a or question. Either I stay home or I may die. This is an and. How do I responsibly continue to live out my life?
And I can just speak from personal experience as we're bringing people back to the State Department of Health. We're doing that in several phases. We're continuing to take our highest risk populations and really pretty much saying we need to have you working remotely, whether that's changing their job description a little bit or making it available for them to be able to do that, and bringing people back slowly but surely so that, again, we can continue to protect those high-risk populations. And the Harvard recommendation is just one of many, and I will tell you that that is much, much higher than what CDC and other public health groups have recommended for the ability to start opening things up with regards to the amount of testing you need to have done.
Yeah, and Victoria, I would say we will never, I think I can speak for us all, we will never abandon our four principles that guide us each and every day.
Michael, WBEZ.
Good afternoon, Michael.
Good afternoon, Governor. Thank you for taking my question. I have two of them. The mayor of Gary says he won't reopen his city until May 18th. I know you're giving cities more leeway to make their own decision on reopening, but is there a limit to that? Say if they want to go even further than May 18th, maybe even into June. What is your position on that? And also, that Tyson plant has reopened in Logansport. That plant alone accounts for 14% of the 6,500 COVID-19 cases among meat processing workers nationwide. What safeguards are in place to keep those workers safe?
You want to take the second one and I'll go to the first one?
So that was the plant that I was referring to earlier. And a big issue there also is how individuals travel into the plant to work and come together, how they congregate live during the week, and oftentimes can infect each other that way and then even return to their homes. So a big part of what we're doing is making sure that we're able to address those specific things to prevent this type of infection from happening again. It's probably not likely to happen in that plant because of the number of individuals that have already been infected. But this really brings to light the importance of working with companies that use migrant workers and use other workers that are in very, very close contact. And we need to look outside of just how we are affecting things in the plant, but oftentimes how they, where they also live and play.
Yeah, and I would, Michael, I would say that I will, and I think we all will, but I will go out of my way to support local leaders and officials if they are looking at or seeing something different than we are. And we'll continue to do that, whether it's Gary or Hammond or Crown Point or Greensburg or Bloomington or Indianapolis, where we sit right now. Yes, the answer is if a local community, and we'll review it step by step. And so, yeah, I guess ultimately this is within reason, but we will try to reason with folks who have a different opinion than we do. And I'm just telling you that 9 times out of 10, if not 10 out of 10, we're going to support the local, on-the-ground officials that may come to a different conclusion.
Eric Berman, WIBC.
Good afternoon, Eric.
Good afternoon, Governor. It looks like Michael and I are thinking on the same lines. The Lake County order is set to expire on Monday. Marion County already has their own extension, but Lake County is set to expire. those hospitalization rates are 5 points higher than the statewide rates that Dr. Box referenced earlier. Is Lake County going to move into stage 2 on Monday, or are they going to need to stay in that for a little bit longer?
Well, they're scheduled to move into stage 2.
So we'll be looking at those numbers again over the weekend and making sure that we're not seeing significant changes there, and working with the local hospitals and the local health officers. And if there are concerns about that, then most certainly we, as the governor has said, work with the locals on what is best for their communities.
Ryan, WEHT.
Good afternoon, Ryan.
Hello there. So I got a two-part question for y'all.
Okay.
So first of all, you said before, as we're moving through the stages and whatnot, that there could be some flexibility in terms of when we move on from stage to stage. Is there a set benchmark, say, if cases increase X amount, then we won't move on to the next stage?
Yeah, in short, and please elaborate, but we take a more global view, so we're looking at those 4 principles: hospital rate, hospitalization rates, and our PPE inventory, and our ICU beds and vents, testing and tracing up and running, being conducted, obviously, but I wouldn't say there's just one hard fast, this percent or 38% or 40% or 42 or 75 or 76. We're looking at this globally and what's happening, because it could be happening in congregate. You can look at a hot spot, but you can locate that to a specific place. Now, how do you contain that there? Or it could be a county, or it could be a region. So this is a little bit more of an elaborate formula than just one number.
And I agree with that 100%. I would also say that it's important to look at why is that area a hot spot. Is that several nursing homes that have outbreaks in the particular county or area? And that is our very high-risk population. So we can predict that there's going to be about 20% of that population that is hospitalized in those regional hospitals, and could be an increasing quickly burden there. Versus a plant where maybe the average age of the employee is 30 to 40, and that is going to be less of a burden. So even in my discussion earlier today with the mayor of Louisville, he was concerned about particular numbers in one county, and when he found out what the source of those numbers were, it actually relieved him to know that wasn't necessarily all just a big community spread. So as the governor says, it's really not something we can just pin on if it's this percent or that percent for this thing or that thing, and that's what's going to make the decision for us.
There's a lot of, and I know, Ryan, I'm not going to move off. You got a second question, but there's a lot of aha moments after when you first see one number, whether it's a county just west of Marion County here where we had 68, but it was one location. So now how do we surge our resources to address it and contain it? Ryan, you had a second question, I think, or a two-part?
Yes, I do have a second part to it. So okay. Looking at other regional or other states in the region, we know here in the tri-state by Evansville, we have Illinois and Kentucky. Governor Pritzker and Governor Beshear are both taking perhaps a slower approach, maybe a more cautious approach, whatever adjective you want to use for that. Is there a concern on your end that maybe Indiana is moving too fast?
No. I mean, again, the word concern, we have a lot of concerns every minute of the day. And we factor in the information that's happening in 92 counties, in the state of Indiana, and then we share that information with our neighbors, whether it be Illinois, Michigan, Ohio, or Kentucky. As I just mentioned, I talked with Governor Beshear this morning, and we shared what we were looking at and completely respect the decisions that he is making. We just want to make sure that we're collaborating as we both move forward. He's learning from us and we're learning from him, and we'll continue to operate that way.
Lauren Chapman, Indiana Public Broadcasting.
Good afternoon, Lauren.
Good afternoon, Governor. This is a question for you, both you and Dr. Box. A few times over the course of this discussion today, You've mentioned, that the state is opening for folks, but that we do want to be cognizant of folks who are at higher risk.
Yeah.
So my question is there any state support for people who are at higher risk over the age of 65, maybe have underlying health conditions, but are also employed and cannot return back to their jobs? I know Commissioner Payne said unemployment wasn't on the table for folks who have health concerns.
Fred, you want to address that directly because it's not exactly the case.
So as we mentioned before, each one of those cases we have to handle on a case-by-case basis. Whether or not a person's benefits will be continued in a COVID-19 situation when they are asked to return to work, and if they can't return to work based upon a health condition or based upon whether or not they're part of a vulnerable population. We are in the process now of working through and communicating with the Department of Labor and actually communicating with some other states on just the right way to approach that. We want to make sure that we're having individuals to go back to work in a safe environment while also trying to ensure that we are respecting what's in place on our unemployment insurance guidelines. From the employers that I've had some communications with over the past few weeks, all of them are really trying to have a safe workplace for their employees to come back to, while also we do acknowledge that individuals do have some concerns about going into an environment. So what we're doing is trying to make sure that we have the right guidance, the best guidance possible. But each one of those cases, as it relates to a person returning to work and who may be a part of a vulnerable population, we're going to have to take those on a case-by-case basis.
Thank you, Commissioner. And Dr. Box, you might want to just use this opportunity to, again, encourage this exact population to go get tested.
So again, this is the at-risk or high-risk population, and the testing is available. So we encourage you strongly to go to our website, to look up these sites. You can either register on the website, or you can call, or you can walk in to these sites. So and look for our drive-throughs, because we have 5 going this week. We'll have 5 more again, I'm sure, next week doing that, and trying to make sure that we're getting out to our most vulnerable populations that have more difficulty with transportation.
We have the resources so that you can have the peace of mind and the confidence to know. Please take us up on this.
Whitney Downard, CNHI.
Hello, Whitney. Good afternoon.
Good afternoon. My question today is, are people limited to one test when it comes to these testing centers? Can people get retested? And also, do you recommend getting multiple tests? I know healthcare workers have been getting them, but what about the average layperson?
I'm surprised this is the first time we're hearing this question, because
Exactly.
we've heard this before from others.
So I know there's a concept out there that some employees need to be tested every 3 days, every 5 days, every 7 days. And I think the point was made earlier by one of the reporters, and I can't remember who it was, but basically you could test negative today and be positive tomorrow. So I feel like everyone should continue to conduct themselves like they're potentially infected and that asymptomatic carrier. So we will decrease the risk of giving this to others. That being said, there are individuals that are in particularly high-risk situations that may need to be tested on a more regular basis, whether that's because of their particular career or job, or whether that's because potentially they are getting chemotherapy because they have a cancer and they're immune suppressed. And I think that our healthcare providers can help us to know who the appropriate people are that should be tested more frequently.
Our final question is from Demetrios WTWO.
Good afternoon, Demetrios.
Good afternoon, Governor. My question is just, I know it's only been a week since your roadmap was released, but I just want to know, have you been encouraged with what you've seen from the data so far and from Hoosiers? And then also on Monday, with restaurants and, bars that sell food opening up at a limited capacity, are there some challenges that you think the state will have keeping those 4 principles intact, moving forward?
Well, we're putting a lot of trust in Hoosiers themselves, and I feel very comfortable about that. Whether it's got to do with a restaurant or a place of worship or your place of business, going back to work. And we've put out guidance and recommendations on how to safely do that. employers have put that guidance out, church leaders have put that guidance out, and I would just, along with Mother Nature, who's presented us with some beautiful days, very enticing, very tempting, but all things in moderation, especially in a time like this that we find ourselves in. I know it's hard, people are impatient, I am as well, to get back out there and just resume, but we can't do that because this virus doesn't respect those actions. And so we're in this together. We're going to get through this together. There is light at the end of the tunnel. We've seen as we measure our resources. And by the way, Demetrios, you've kind of hit on what the word concern has been used twice, and then you touched on this again. This just underscores how important how we make our decisions is. And by that I mean those 4 principles: looking at the data, letting it guide us. And by the way, there's another side to this. We are not making knee-jerk decisions or reactions. There are some other places around the world who very quickly threw a lot of resources in an area because they read or saw something on television and said, why don't we do that? And stood up and spent a lot of money and then had to tear down because it was never used. That's not the way we've operated here in the state of Indiana. We're letting the facts guide us, and we'll continue to stay on that path.
Thank you for joining today's briefing. Details regarding Governor Holcomb's next briefing will be sent in a media advisory.